What's up, everybody? I'm Dr. Joshua Good. Today I'm going to show you a little bit about shoe wear tear. Shoe wear. What's up, everybody? I'm Dr. Joshua Good. Today I'm going to talk a little bit about shoe wear patterns and what you can look for with regard to your shoes. This is really important because a lot of people who have shoulder pain or What's up, everybody? I'm Dr. Joshua Gooden. Today I'm going to talk about shoe wear patterns and what you can look for and how to kind of tell if you're undergoing possible dysfunction and how this can give you some signs of what to really pay attention for if you're having some sort of foot pain, ankle pain, knee pain, hip, or low back or SI joint pain. And it's really important because, one, if you're having pain, it's already too late. But let's talk about some clues that you may be suffering this, and all you have to do is figure out about how to walk, right? So when we walk, we're looking at heel strike, mid stance, and then toe off. So this type of positioning, and each shoe is different, right? And depending on how you actually run, a lot of people heel strike, mid stance, toe off, but also a lot of runners out there will run more on a forefoot, so they'll be more like this. But either way, what you're looking for, first things first, is we're going to look at the bottoms of the shoes, and we're going to look to see what is worn out, what is not worn out, what type of grips are there, and what are not there. And of course, we're going to look for symmetry. So you have to look for that, right? The first thing we want to look at is symmetry. So normally you'll see the back left or the back side, what side is worn out. And these are older shoes, and I highly recommend that you guys start with some older shoes because new shoes aren't necessarily as worn out. And then, of course, if these are your lifting shoes versus your walking shoes versus your running shoes, that is all going to matter as well. But generally speaking, what we're going to do is we're going to look at the back of the shoes. I like to start here, and I like to work our way forward, just like we do heel strike, mid stance, toe off. We want to have this type of positioning where we kind of rock and then kind of come off like that. So the forces should come off like this and off to the great toe. And you should see some wear and tear towards the end here and towards the end here, and have almost, in theory, a perfect type of pattern going this way. So when we look at these, and I'm going to try to show you, but when I come upwards, it may be a little bit difficult for you, but I'm looking both sides, right? And I'm going to look not only just top down like this, but I'm also going to look this way to see what side is more worn. And if you see right here, you're going to see that this side's more worn out, this side is more worn out, and then I'm going to compare them to see if they're fairly similar. And that's what you really want to look for. And here, they actually look pretty symmetrical. I would actually argue that if I had to choose one side or the other, that my right or my left foot is actually a little bit more wearing down. So I'm hitting a little bit harder on this left side. So then of course I will follow that pattern of wearing, and I'm going to look left to right, right to left, see what is better. Because a lot of people will notice if they're having knee pain or something like that, they're going to end up collapsing and pronating that foot inward. And what you really want to notice is that if you're collapsing and wearing around this area, that means your arch may be collapsing, your hip may be collapsing, and as a result, you're getting a lot of meniscus pain. So you'll see that in a lot of people as maybe one side of the arch is not going as perfect this way and that way, and you'll start collapsing a little bit more on this side, and so one side of the foot will not be as worn on the outside, but maybe more worn on the inside. And likewise, a lot of people will not have a lot of wear and tear on this side, on the front part where they toe off, which is really important. That's why they call it the great toe. They may not have that, so they may have more pushing on this side. And so I'm guilty a little bit more. If I had to look, my right side of the gait is a lot better than my left side, and I actually already knew that without even having to look at this, but this confirms it because I have a lot more of a left-sided ankle instability, and I have a lot more weakness, so I actually hit a lot harder here, and I actually don't have as good great toe push off or extension on my left toe, so I actually end up seeing it on this side. So my gait and your gait for somebody like that would hit a little bit harder, and then they would collapse a little bit further in, and then what they would do is push off this way a little bit or this way a little bit, as opposed to pushing off this way. So guys, this is really important. Again, if you're having injuries, chronic injuries that are not being resolved, you're doing some myofascial rolling, you're doing this, you're doing that, and some things aren't just clearing up, take a look at the bottom of your shoes. They can provide some clinical indicators or indicators that something's going on. And again, you just need to make sure that they're symmetrical. It's not to say that everybody's going to be perfect, but you need to be symmetrical the best you can so that you can prevent one side from wearing and tearing and causing some dysfunction. So guys, highly recommend this, especially if you're an endurance athlete or if you're trying to up your mileage. Highly recommend looking into how to tell and how to really like keep an eye on your bottoms of your feet, because it's really important, because these are the things that ground you from the bottom up. So guys, definitely look at the wear and tear patterns at the bottom of your shoes. All right, guys, I'm Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys next time.